We could give them the money instead of giving it to the insurance
Okay,
companies.
so that's a conversation that has been happening about giving. The president has said there are billions of dollars that the government could send directly to people to purchase their own much better health care. How would that even work?
Well, we don't have market forces at play right now. Think about, what is it called? It's called the Obamacare Exchange. It's a marketplace. What does marketplace mean? People actually have a role in a marketplace. They make decisions about what they value. It was originally designed to be 50% truly people from the private sector, like that couple, coming in, and then 50% government subsidized folks who couldn't afford their insurance. We have priced the systems now so heavily with government subsidies that they crowds out the private sector.
How would a check, getting a check in the mail, actually work?
If you had a check in the mail, you could buy the insurance you thought was best for you.
Right, but how would the government actually make that happen?
Oh, we could use health savings accounts. There are different tactics, flexible savings accounts. There are tools that exist right now that we could use. The question is that the best way for us to use taxpayer dollars? And this is critical. Is it sustainable? If we truly create a marketplace, can people use that money to wisely use their power to buy insurance that helps them?
Hi, my name is Dr. Rubin, and there is essentially no healthcare reform that's going on here. All they're doing is regressing back to prior to the Affordable Care Act, where if you were generally healthy, you would get access to health care that was at a much lower rate. And if you have some kind of pre-existing condition, good luck trying to get access to health insurance. It's going to be much more expensive because we live in a society in the United States where we have private insurance companies that are for-profit driven, and then we have a public option, but only those on Medicare and Medicaid. In my opinion, if we're going to make healthcare reform that is meaningful, we need to make sure that it's equitable, effective, and efficient. And that means that we're going to have everybody pay their fair share, cut out as many middlemen as possible. We also need to have reforms to medical education so that is more affordable and accessible, because we are facing significant healthcare shortages in many parts of the country. And those multiple reforms would end up cutting a lot of red tape and administrative costs. And we need to work on ways to drive down the costs of drugs as well. But none of that is going to really happen if we're just going to give a small amount of money to individuals to then go out and buy their health insurance like we did before the Affordable Care Act.